Good evening and welcome to the Lozells Ward Forum. We are having a special Lozells Ward Forum, which is in relation to some of the challenges in these unprecedented times that COVID-19 has caused. I want to say a big thank you to all those that are joining us in a very different way. We're trying out something new, an online Ward Forum. We have a number of guest speakers from the council and partner agencies who I will bring in shortly. Please remember you can contribute to today's forum by asking questions and commenting on the various platforms that this meeting is being shared on. So please do comment. Please do bring up any questions throughout this meeting. We will try and bring those questions in whenever we can. Whilst we also want to pay tribute to all those residents in Lozells, in our city and across the country who have unfortunately lost their lives due to COVID-19. These are very, very difficult times for many, many families up and down the country. Over 30,000 people across the United Kingdom have died because of COVID-19, and it's incredibly sad. So our condolences go out to each and every family, including we know that people here in Lozells have also who have lost their lives because of COVID-19. When we usually have these Lozells Neighbourhood Forum meetings, there's a particular officer of Birmingham City Council who would always be there to help us. Not only did he help when it came to meetings such as the Lozells Neighbourhood Forum or the Lozells Ward Forum, but he also had a huge role to play in community development, in supporting elected members, supporting councillors, working very closely with other communities, and not just here in Lozells, but right across the city. I'm referring to Ken Bryan, who unfortunately passed away over the weekend due to a heart attack. Our condolences go out to his family, his friends, and the community who are hugely, hugely saddened by Ken's death. Ken was a gentleman, somebody who was hugely passionate about the community. He lived locally to us here in Lozells and really, really cared about community development. And Ken will be hugely missed by us councillors, by the community, and by many others. I want to bring in 2-3 colleagues who are with us on the call right now to talk a little about Ken and just pay tribute to Ken very, very briefly before we start the rest of the meeting. I'm going to ask Councillor Paulette Hamilton, who's the councillor for the Holyhead Ward, and also who's the cabinet member for adults and social care, to come in and talk a little about Ken, to pay tribute to Ken initially.
Right. Good evening, Waseem, and good evening to everybody who's listening out there. I haven't spoken a lot on social media about Ken because he was someone that was very special to us all. Ken was a man of few words. And if you knew Ken well, you absolutely knew that Ken would say 2 words, and or 3 words, should I say, councillor, or he'd call me P. Consider it done. And you just didn't have to even challenge or ask again. He would come back with the answer and the response. Now, I was deeply saddened by his death, not because he was an officer of the council, but because he was a friend. He was a friend and someone I'd known for probably over 20 years. So this evening, I'm not going to say a lot, except he will be truly missed. The way he does things will be truly missed. The way he used to work with people will be truly missed. His love for the community and what he would do, he would go over and above, will be truly missed. And we have lost somebody in the community this weekend that I think we will struggle to find anyone of his caliber for a while to come back and replace him and all the work that he's done. And I'd just like to say to his family, my heart go out to you, but just know the outpouring that Ken's had, it's because he deserves it. He was a good man who should have had many more years, but God knows why. So that's my tribute. Thank you, Waseem.
Thank you, Paulette. That was beautiful and very effective. Can I now bring in Councillor Sharon Thompson, who's the councillor for North Edge Baston and the cabinet member for Homes and Neighbourhoods.
Okay, thank you, Waseem, and good evening to everyone. I think first of all, I just want to send my sincere condolences actually to Ken's family and his close friends and the community at large, because I think everybody's felt the passing of him over this last weekend. Ken was definitely one of those genuine souls, gentle person with an infectious smile, always willing to help and go the extra mile for anybody really that came his way. And he just had a genuinely good spirit about him. I know he's going to be missed deeply in the community. I know a lot of people are feeling massively affected already just by his absence and loss. And we're at a time when we're still in lockdown. I know that I've spoken to some of his colleagues at the council, and it's clear, it's very clear that they are absolutely devastated, not upset, but devastated at this time. It's a big, massive loss to the community. And again, my thoughts go out to his family, the children, his wife, and everybody else that was close to him, because he is an absolute exceptional character with a clean heart, and one that, will not be easily forgotten at all. And I'm hoping that at some point when we come out of lockdown, the council will be able to do some form of tribute to Ken, because I think it's well deserving. He's very much loved across Handsworth and a real feature. So that's something that we need to look into. Thank you, Waseem.
Thank you very much, Sharon. I'm now going to bring in Sean Stanley, Sergeant Sean Stanley of the local neighbourhood police team. And obviously, Ken worked very closely with many other agencies, including the police. Sean, do you want to pay tribute to Ken on behalf of the police?
Good evening, everyone. Just like to send my condolences to Ken's family and his friends, and obviously everyone else that knew him. Been very fortunate to work with Ken for the last sort of 15, 16 months that I've been in post here. The other councillors already sort of or touched upon like his personality. He's just found him to be a very warm person, very caring, certainly cared about the community he was working for, cared about all his partner agencies. I'd sort of describe him as like the driving force that sort of made us partner agencies sort of work together. He's fantastic, man. I've been reading his tributes over the weekend on Twitter and other social media, and those tributes sort of describe what a gentleman he was, and he'll be sadly missed by myself and all the other colleagues here. Thank you, Waseem.
Great, thank you so much for those beautiful tributes to Ken Bryan, and he will definitely be missed. And as Sharon said, we'll as a council and as a community and as a city, we can look at when things come back to some form of normality after COVID-19 to pay tribute to Ken. And we know Ken also lost his father in March too, and only had buried his dad, who is also a carer for, and very, very close to Ken, was very, very close to his father just towards the end of March. So it's a huge loss for the Bryan family and the community, who are the tight-knit community here in Lozells and Handsworth. Moving on, this is a special meeting to discuss a number of key issues that impact on our community. We're going to focus on bereavement services, get an update from Councillor Thompson on that. We'll get an update on community safety from Sergeant Stanley. Then Councillor Hamilton and Dr. Justin Varney, who will be joining us, will give us a public health update too. We may be able to fit in some stuff around some information around business support that's available to our community too. So I'm going to start with you, Councillor Sharon Thompson. Could you give us an update on how things are progressing within bereavement services, and give us a general update about how your department's been working through these very, very difficult times?
Yeah, absolutely. Thank you, Waseem. I mean, first of all, I just want to say to actually everybody across the city who have lost loved ones at this time, whether it's from COVID-19 or not, to bury or cremate a loved one at this time is very, very difficult because of the levels of restrictions that are on. We're at a time at the moment where, we're having to live life slightly differently to how we would normally, and it's taking some adapting to take to that. I think we have to be really clear that I think in Birmingham City Council, the key objective for Birmingham really has been to try to reduce the likelihood of the virus spreading, and that's what's governed some of the changes that we've made in bereavement services. So one of the first things I think everybody knows, and it's well documented, that the number of mourners that can attend a funeral for bereavement services for funerals in Birmingham is at the number 6 at the moment, We are constantly reviewing that, and we will be reviewing that over the next coming days to see if there's any changes or if the situation has changed. That doesn't include, the number 6 is mourners, so it's also an imam or a priest alongside the funeral staff or anybody that's going along to record the funeral as well. So that's not included within the number of 6. We've recently, previously we closed all the crematoriums and cemeteries because people were attending them in mass, not really adhering to social distancing. And also it was making it difficult for staff when they were trying to manage the restrictions in terms of the numbers. However, last week we have opened, following on from the guidelines from the government, we've opened up the cemeteries on a part-time basis. So it's after burials or cremations take place. Those opening times are from 4:30 till 6:30 in the cemeteries, apart from Handsworth, which is 6:30 to 8:30. And recently, over the last weekend, we've also opened up over the weekends as well. That's to give people more opportunity to go along, to visit the graves of their loved ones, and you know, spend some time there. Those visiting hours are from 12 till 4 on a Saturday and Sunday, but that's except from Lodge Hill Cemetery, which is open from 3 till 6:30 on a Saturday and 12 till 4 on a Sunday. Sutton New Hall and Handsworth Cemetery, their times are slightly different, and their times are from 5:30 to 8:30 on the weekend. I just think we need to make it really clear that the reason why we have had the restrictions on there is to reduce the likelihood of the spread of the virus spreading. If I'm completely honest, I would prefer to have less people mourning at a grave if it means that we can have less graves or less people passing away. The aim has to be to make sure that we can give people a dignified send off and farewell or laying to rest as possible, in line with their beliefs, and also trying to make sure ultimately that we're not spreading the virus, and that's one of the key things. So I think that's it from me, Waseem, unless I've got any questions.
So Councillor Thompson, any idea when we will go back to some form of normality when it comes to cemetery openings?
So I think when it comes to cemetery openings, it's also going to be governed by the government's guidelines as they start to lift the restrictions when it comes to COVID-19. And it also depends on the way that the rate of the virus spreading is across the city. So those are key things that we need to keep an eye on. We are constantly reviewing that, and that's with all the changes. I think it's also, I would pay tribute at this time to the staff that work in bereavement services in the cemeteries, in terms of the mortuary and also the registrations, but also the funeral directors from across the city and the faith groups that have been really supporting this and helping us to make sure that even when we get things wrong or we feel that they're not going as smoothly as possible, things are flagged up as quickly as possible so that we can try and make those changes, but also just supporting. I know some of the churches and the mosques have been absolutely phenomenal with the support, and it's a very difficult area to work in. But again, I just ask people to just to consider the guidelines. And I do have a plea that, you know, our staff are actually just carrying out actions that they've been asked to carry out. So if there's any grievances about any of the restrictions, please email me, sharon.thompson@birmingham.gov.uk, and not take it out on the staff because they're just doing their jobs at this time.
Sharon, thank you so much. Can I say thank you to you for the leadership you've shown in these very, very challenging times within your portfolio, and I hope you're able to pass on our thanks to your staff who worked in some very, very challenging environment, a fast-moving environment, and the way they were able to adapt to some of the changes and the guidance from government was really well received.
And Waseem, before I go, just one thing. I can ask people to keep an eye on the website for updates. We know that for VE Day, we're going to be extending the times for the cemeteries. And also when it comes to Eid, we're going to be looking at what we can put in place for then also. So please keep signed up to the updates for Birmingham City Council, whether that's the website or the social media account. Thank you very much.
Great, thank you. Take care, and thank you for joining us today.
Thanks a lot. Bye-bye.
Can I at this stage just say a huge thank you to all the organisations across Lozells who've supported the authorities, whether it's the police or the council, whether it's the government's request. You've been phenomenal. All faith organisations have been outstanding in Lozells. They've really shown leadership during these difficult times. They've also been really well supported by volunteers from across the community. I also want to say thank you to the work that the schools are doing across Lozells too. Not all children are going to school, but children of key workers are going to school, are going to the schools, and they're getting really well supported. So I want to say a big thank you to them, and just the community organisations, some of the advice organisations within Lozells, the important advice they've been providing to residents at these challenging times. This has been a huge team effort, and I think we've not only seen the best of Lozells, we've seen the best of Birmingham in these very, very challenging challenging times for us all. I also want to thank West Midlands Police. Sergeant Stanley is with us. Mr. Lozells, Rob Capella, and Sergeant Stanley's entire Lozells neighbourhood team have been very, very active in supporting our community during the COVID-19 period of time. Sergeant Stanley, I'm going to bring you in now to give us a bit of a update on community safety matters in Lozells. There was one or two questions which I'll bring up on the screen too, but I'll let you start off and then we'll bring the questions in.
Good evening, everyone. Firstly, I just want to thank everyone that has been abiding by the COVID-19 regulations, staying in at home, not making essential journeys. Everyone doing their part to support the NHS, which is, as an organisation, is what we're doing our part to do that. As far as crime's concerned, over the last couple of months since the lockdown, it's fallen everywhere. My officers have been out and about. We've had our own challenges as well, but we have been out and about, predominantly engaging with people, explaining the lockdown, encouraging them to stay at home. In the early stages, people didn't necessarily understand what the lockdown was, so we've been doing our part to explain that to them. On very few occasions, we have had to enforce, but like I say, they have been very few. The vast majority of people have been staying in, and I would like to thank everyone within the community for doing that.
Sergeant Stanley, in terms of figures, crime figures, has there been an increase or a reduction in these current times? Are there any patterns you want to share with us?
Crime-wise, let's give you an example. Burglary of people's houses. They've fallen because obviously a lot of us are sort of staying in more. Burglary of buildings, which is burglaries to shops, predominantly commercial business and industrial premises, schools, that kind of thing. Again, they haven't risen, but it is something for the local community to sort of be mindful of. Obviously, there's going to be a lot more empty shops. If you are a business owner within the premises, I would urge you just to check from time to time on your premises.
Okay. So, Stanley, there's a question around drug dealers operating on Villa Road and Lozells Road and causing challenges around social distancing. I'm not going to bring up the actual comment because it might expose the person who's making the comment in the public domain. But do you have anything to say about that? Have your officers been patrolling these main key shopping centres, Lozells Road, Villa Road, bits of Heathfield Road in our patch, where they're starting to get busier and busier?
Yeah, that particular area is one of our areas that we predominantly focus on for the issues that you've just described there. Over the last few months, not just in lockdown, we have had a number of arrests in that area relating to drug dealers and people going to court and ultimately prison. That's not going to stop. I appreciate we see it as well that there are still one or two people there that shouldn't be there, and we are engaging with those groups and taking necessary action when appropriate.
Okay, another question that's come up is around domestic abuse. We know that there's been an increase in domestic abuse as reported nationally, and we've seen some citywide coverage of this too. What support is available, and what advice would you give anybody watching who may be a victim of domestic abuse in their house right now?
Yeah, ultimately, I mean, you've just touched on that. So there is a rise nationally in domestic abuse. I can't tell you the exact figures, whether that's risen or not in the Lozells area. But my advice to you is just because the lockdown is here, we are being encouraged to stay at home. If you are a victim of domestic abuse, please call us. Appreciate it's always difficult being in the same house as that person. You can call 999 and dial 55. We'll set the police will read into that as you need our help, but you can't speak, so we'll come out to you. And by all means, if you need to get out your house, get out the house. We'll support you on that.
Great, thank you. And just finally, how is the well-being of your team? The Lozells neighbourhood team is very frequent in Lozells. There's a lot of positive relationships. Is everyone fine? Everyone well? Generally, how's your team doing?
Like every organisation, we have had our challenges over the last few weeks. We have had officers in isolation, but at this moment in time, we're at full strength. Every officer that I have available to me is here. We've not taken annual leave during these times. We've all personally been in touch with people that we know passing away, unfortunately, through the coronavirus. So we are all in this together.
Great. There's a question from one of our local youth workers, Danish, and the question is, could you ask if numbers of young people in the area have increased during lockdown? So these are groups of young people congregating potentially on our streets. Is there any evidence around that?
I can't say there's an increase compared to before the lockdown in the number of young people around. I've got to say, Lozells in particular, from what I can see, I am out there daily. A lot of young people are staying in. Parents and guardians are doing a very good job at keeping people in. Like everyone, young people, older people, there are people we do sometimes have to speak to again to explain, encourage, and engage with those youths to stay at home, and a lot of them are receptive to that, and they do fully understand what their responsibilities, like all of us, during this lockdown.
Great. Sean, do you have a final message for the residents of Lozells? And obviously there'll be people from outside Lozells watching too. Is there any message as we go into the bank holiday weekend? The weather's going to be good.
Yeah, we are out and about, and we'll continue to be out and about. And if you do need us, call us. There's probably that perception out there. Like take the NHS, for example. I think recently in the media said people weren't going into A&E for fear of impacting on NHS staff who are dealing with coronavirus patients. We are here. We are busy. And just on a final message, you're all doing fantastically at staying in and abiding by the government guidelines. Let's just push that for as long as we need to do to get rid of this awful virus and keep us all safe.
Great. Thank you for everything you and your team are doing, Sean. We really appreciate your efforts and efforts of all frontline workers, our police, the fire service, the NHS staff, those working for our local ambulance trust too, and generally everyone else on the front line. So thank you very much, and thank you for joining us today. It's a bit of a trial, and let's see how it goes. And if it works, I'm sure you'll be more than keen to come back in future meetings too. We can have online. So great, and do give our regards to your team. Take care. Thank you.
Thank you, Councillor, and take care, everyone.
Great. That was Sergeant Sean Stanley, who's the sergeant for the neighbourhood police team here in Lozells. I'm now going to bring in Councillor Paulette Hamilton. Hi, Paulette.
Hello again, Waseem. You're right.
Hi, I'm good, thanks. Paulette has had a hugely challenging role. Not only does she have a leadership role here within our city. Paula, you've been involved in a number of national work through your role as the as a senior person within the local government association. So you've been on calls with ministers and various senior civil servants. Paula, could you give us an update? I know there's been a lot of coverage around COVID-19, but just give us an update of where we are currently in terms of the advice that we're getting from government, the guidelines we're getting from government, but generally where Birmingham and if you've got any data for Lozells in terms of COVID-19 and the impact of COVID-19.
Well, regarding the data, I always allow Justin, who's coming on air, that is his baby. So I will leave that to him. So what I'll do is I'll start with some basic, with a basic update. COVID-19 is a pandemic that hit us in the UK in January of this year. We found our first case. In Birmingham, we had our first death on the 7th of March. It has absolutely ripped through our communities, and it has been very, very difficult for large numbers of different communities. And if people don't mind me saying, I have said it everywhere I've been, if you are elderly, if you are from an ethnic minority group, if you are disabled, if you are from a vulnerable group, you seem to be more highly affected by what's happened with COVID-19. At first, when we realized that COVID-19 was such a big issue in the city, as you will know, Waseem, we did lots of work. We worked with public health to ensure that we had a strategy in place. We started off looking at our flu pandemic strategy, and we worked through that to ensure that every department within Birmingham City Council and with our partners, that we were fully prepared for what was about to happen. But the issue was, we had this thing in the community where we had to do social isolation. And this was for shielded communities predominantly. And people just didn't understand about social isolation. So if you were over 70, if you had specific conditions, and the government would actually give us the list of people that needed to socially isolate. People didn't understand this. But then we had an even bigger problem, because we had another group out there that were in vulnerable groups. They had sickle cell anemia, they had thalassemia, they had diabetes, they were overweight, they had high blood pressure, they had heart disease, some people kidney disease. So people didn't understand that if you were in any of these vulnerable groups, because to be honest, the data we were learning as we were going along. As the months went by, we've been gathering more and more information. Now, where we are at the moment is we have three big issues. The issue of personal protective equipment. At the moment in Birmingham, we are getting the personal protective equipment. The problem we have with that is that it's very sporadic, so it remains a problem. We've been getting out of date equipment, and we've been getting equipment that isn't quite suitable enough. So what we've done again, we've worked as a system, and we've gone out to other parts of the West Midlands, and we've said to them, let us look at our businesses, let's come together and get this equipment. It is still not enough, so it remains a challenge. The second part of the issue with COVID-19 is around our nursing and residential homes. We have 301 nursing and residential homes. 184 of them belong to adult social care. The problem we have within our nursing homes, we haven't been tested. On the 16th of January, the World Health Organization made a statement. They said we needed to test and test again. But not only do we need to test, we need to track people, and we need to do the surveillance there where we can isolate them. So if people know that they have COVID, that they self-isolate for at least 7 days. People just didn't understand this. And then lastly, within our homes. We only started to test about a week ago, so we weren't able to track how many people were actually dying in the region. But the third issue we had, which I must highlight today, because of the government gave clear guidelines around COVID-19, and that was the 2-meter social distancing. Do not go near other people. The second one was you needed to wash your hands. Wash your hands, wash your hands, wash your hands. The other one was stay at home. When we went into lockdown on the 23rd of March, may have got the date wrong, you needed to stay at home, only an hour's exercise each day. People struggled with that, but they have been abiding by the rules. And for that, I thank them. I thank people for all the voluntary work they've been doing in this area. And I thank people all my life. I thank them for all the food they have given and distributed across Birmingham, but Answorth and Lozells, we have been phenomenal at helping our neighbours. But with COVID-19, some of the other issues were around the hospitals. Because people became very fearful, Waseem, what they then said, you are on social media, do not go to the hospitals. Can I make a plea today? Please do not stop going to hospitals and your GPs, because they are open for business. They are looking after people, even if you haven't got COVID-19, and they want people to get well. Because another issue that we've found that's been coming through, people have been dying at home. It's not COVID-19, and we are not sure why. So we need people, if they need treatment, to be going to hospitals. I've filled a lot into a small space of time, but people need to understand that that services are here to help you, and that if you have any difficulties, please do not hesitate to contact us. Sorry, I've said a lot in a short space of time, but I hope it's been clear.
Absolutely, it's been very, very clear. Just to pick up on another point and to dig deeper into it, obviously Lozells has is a hugely diverse neighbourhood. Got people from all over the world that have come here, particularly from the South Asian and African Caribbean backgrounds, and there's been a lot of national coverage of higher levels of COVID-19 positive tests and unfortunate high levels of deaths from the Asian subcontinent community, the South Asian community, and also the Caribbean community. Or that's what it's perceived to be. You've been involved in some of the conversations with government and also with the local government. So do you want to quickly give us an update on where we are with those pieces of work?
Right. Waseem, what happened in that area, there was an absolute outpouring from the community, because a number of high-level people had died. And what people started to do through WhatsApp and Facebook and other mediums, they started to highlight anecdotally the number of people from the South Asian community and the African Caribbean community that were dying. But it wasn't only that. What we started to see was high level of deaths amongst our doctors and nurses, which were from predominantly the ethnic minority communities. So what then happened in Birmingham, when we saw this happening, it was felt, rather than wait for it to become an issue, which we knew it was, what we did as a city, we called all the health professionals together, and the chief exec, and Justin Varney was at the meeting, and we decided that people didn't understand what was going on. So what we would do, we would give people the opportunity to ask questions. So they then wrote in over 600 questions, and we had the Health and Wellbeing Board. What the Health and Wellbeing Board did, it answered some of those very difficult questions that people didn't understand. But what we were then able to do as a system is feed those questions, feed the feeling of people from Birmingham up into the national arena. And we were able to then start the conversations, but we were absolutely clear. Matt Hancock had said he would have an inquiry relating to why so many people from BAME communities were passing away. And what we found from some of the statistics we gathered at that time, that proportionately people from the South Asian community were actually dying at a higher rate. The figures are still being crunched, we are not overly sure. So we fed in all the figures, the documentation from the professionals that had fed into that meeting. We then answered every single question that members of the public asked us. And what that did was we were able to feed in on a national level into whatever potential inquiry that was going to happen. Unfortunately, Waseem, we've now realized that when we went to the first meeting, there will no longer be an inquiry. It's been changed to a review, and the guidelines have been changed. So with that, we've written to Matt Hancock to tell him what we had done, and now we've moved on, and I've written another letter actually stating to Matt Hancock that unless we get a public inquiry, we will lose the trust and confidence in the very community that we were trying to allay their fears. And I'll stop there.
Great. Thank you for that. And we'll be watching with immense interest how those reviews, it's very disappointing that the government's now decided to carry out a review rather than a full-blown investigation into this. But you're also doing a piece of work.
Can I say, Waseem, I need your residents to actually start putting pen to paper and saying what they're feeling, and actually writing in to government and saying, we want a proper inquiry as to what has happened. It cannot just be people like myself. It has to be the general public that are voicing their concerns in this area.
Great. So what as an action, what we'll do is we'll draft out a letter and see how many signatures we can get from residents in Lozells, and get that sent off to the Secretary of State for Health, Matt Hancock. And as I think I had a conversation with you last week, one of the key things that's come out again in this report, it shouldn't be a surprise in the various reports, is the areas where there's higher health inequalities have suffered the most when it comes to COVID-19. And for me, born and brought up in Lozells, lived all my life here, the health inequalities have never changed. They've always been really, really bad. And, you know, we built that Finch Road Health Centre many years ago, and that was supposed to be a primary care centre with services close to our communities, so that our communities can access those services at the earliest stage possible that will help and prevent some illnesses developing further. And yet, you know, if I'm absolutely honest with you, as the councillor for Lozells, I'm very, very disappointed with the services that have been provided in the Finch Road Health Centre. You know, we've got some brilliant GPs in there, but a lot of the space in there is being used as office space, and it's not being used for services which our communities desperately need. So I think in the very near future, we have to really kickstart that campaign again in terms of ensuring we've got the right services that are close to our community so they can access them at that very, very early stage. And we want to work in partnership with yourself, with Dr. Justin Varney, who's just joined us to do, Justin, to ensure that Lozells and our communities in Birmingham, particularly within inner city Birmingham, where we've got massive levels of health inequalities, we can start to, you know, really reverse those health inequalities and do it very, very quickly. So in future, when things like, you know, the COVID-19 pandemic do hit our city and our country, you know, we're not getting these what we perceive, because I know the facts and figures aren't there, and I'm going to ask Justin about that shortly, but there's perceived to be a higher number of deaths in places like Lozells and Handsworth, because as a close-knit community, there's a lot of information that gets shared, and a lot of these anecdotal information, and, you know, we know of certain people that passed away, and there's that real perception. So I'm going to bring in Dr. Justin Varney, the Birmingham's Public Health Director, into the conversation. Justin, are you hello, and thank you for joining us. Are you able to again share some figures more locally or citywide? I know there's a map of super output areas, which is quite difficult to work around because ward boundaries. You know, in Lozells, there's 4 different super output areas that we're part of. But is there any information you can share with us? And again, just what are the key messages our community need to be taking on board?
Sure, and thank you for having me. And sorry I can only be with you shortly today. So I think the first message is to get across that we're still in it. You know, we are seeing a reduction in the number of new cases, and the rate in Birmingham in terms of new cases, the increase is slowing. So instead of going up really vertically, it's starting to flatten out. But what we haven't had yet is a day with no new cases, and we sadly haven't had a day yet with no new deaths. So this is the reflection of all the hard work that we're doing, staying at home, keeping that physical distance, and washing our hands for that vital 20 seconds regularly to stop spreading the germs. And all of the last 6 weeks of lockdown have played out now in reducing that rate of spread. And you will have seen on TV them talking about the R rate. So this is the infection rate. So if I have COVID in the beginning of the outbreak, if I went outside, I would on average infect 2 to 3 people, and those 2 to 3 people would infect 2 to 3 more people. So if you think of it in threes, depending how good your maths is, you go from 3 to 9 to 18, and then it very rapidly increases. If that R number is less than 1, that means I infect less than 1 person. That actually, if there are 100 people who've got infection, the next day, they only infect 80 people, and those 80 people only infect 40 people, and so on. So you can see how actually gradually the numbers come down, but also it stays as a manageable amount. Now, the ONS, the Office for National Statistics, has, if you said, Councillor Zaffar, published the data, a medium super output area. They've published the death data for the first couple of weeks of April. And I think it's Lozells East comes up as one of the higher areas. Now, what's really important is that to understand is, one, that it's very small numbers. Two, that the data doesn't tell you in the way they presented it in relation to the population of that area, and it doesn't tell you, most importantly, actually how many care homes there are. So we have been doing some work with Councillor Hamilton to look at how this looks and what's going on in those areas. And the top 4 areas in Birmingham in that data set, and Chester Road, which is very close to Councillor Hamilton, I know, is one of the areas that has the highest number, for example, but it also has the highest number of care homes. And we are talking small numbers. So in some areas it's 11 deaths, highest is 17. So if you've got 4 or 5 care homes in that area and they've all lost 3 people, that will instantly move you up. So I would say to at the moment, don't read too much into that. I was quite surprised they published it because it's very, very small level data. And you could potentially identify people through it. So we don't at the moment have a decent breakdown by ward level. We're working with the NHS to try and get that. But ultimately, it doesn't change what we all need to do. We all need to stay home as much as possible, only going out for those essential things like medical appointments, going to the shops and taking that daily exercise. And when we do go out, we need to keep that physical 2 meters distance to protect ourselves when we go. So I think that's a really important thing. Although it's interesting, everyone's fascinated to know what's on their doorstep. In reality, it doesn't actually change at the moment, the advice we're giving.
Thanks for that, Justin. We've got a question here around doctors' appointments.
Sure.
Are GPs and I know if Toby Lewis was here, unfortunately, as I said earlier, he's unable to make it today because of an emergency that he's dealing with. But would we, are the hospitals planning to reopen some of their key services again? I do know as a non-exec director of the hospital, but I want to put it to you because I'm acting in my capacity as a local council.
So yes, so first off, the NHS is open. And this is a really important message I want to get across. If you're sitting at home and you get a new symptom that's new and different, if you get sudden crushing chest pain, if you get shortness of breath, then you ring an ambulance, ring 111, ring your GP. If you develop a new rash, ring the GP practice like you would have done pre-COVID. The GPs have worked really hard to think about what can we give you advice about your health over the phone, what might be a video consultation, a bit like this, where we need to see something, but we don't need to touch you to make a diagnosis. And then if we do need to examine you physically, how can we bring you to a site that will keep you safe when we do that? So there are a range of different sites across the city. Some are for people who we know have got coronavirus symptoms, and therefore we're taking them to a specific site where all the doctors have all the protective equipment you would expect. And some sites are what are called green sites, where patients have symptoms that have got nothing to do with corona. We don't have any suspicion of coronavirus, and the GPs are able then to examine them in a slightly different environment, which in general is just a bit warmer because we don't have to have the windows open and the ventilation going. What you will have also seen in the news is the NHS is gradually starting to open up routine things again. So we're going to start to see elective surgery, people who've been waiting for hip replacements, for example, that will start to come on board again. Cancer treatment, some of that's been deferred, that's going to start coming back as well. And the NHS across the system is working together to work out which sites can be opened safely for those kind of routine procedures, and which sites need to stay primarily for responding to COVID, because we are still getting new cases. We still have a lot of people in hospital with COVID, and we're not going to be through it for a little while yet.
A question that's come to me via text. You mentioned Lozells East area. I think you were referring to a super output area. So can you just clarify what Lozells East is and what you're referring to?
So Lozells East is one of those super output area. So it's part of the Lozells Ward. And the easiest thing for people to do, actually, and as I said, I mean, you know, this is where if you want to geek out in data, go onto the Office of National Statistics website. You can put in your postcode and it shows you exactly where you are on the map. And as you described exactly that point, that Lozells as a ward has 4 of these areas in it. But if you do put in your postcode, it goes down to your street and it shows you the area where the deaths have occurred. In the vast majority of Birmingham, this is about 3 to 4 deaths in each of those areas. And each of those areas have about 100,000 people living in them. So that's why they're defined the areas that they are. I think it's one of those things, if you've got a particular fascination, go and have a play on the website. But ultimately, it doesn't change our understanding of what's going on. And it really doesn't change actually what we're asking everyone to do.
Great. I'm going to bring Councillor Hamilton back in. Councillor Hamilton. Paulette. Hi. You're on mute, Paulette.
Sorry about that, Waseem.
There's a question for you, as again come up on text. We've got a number of hostels within the Lozells area. Are Birmingham City Council aware of measures to protect those particular residents?
I cannot.
Did you get that, Paulette? I think Paulette's struggling to hear me. Justin, do you want to pick that question up? I think.
Yeah, sure. So just while we're waiting for Councillor Hamilton to come back in, since the beginning of the outbreak, the council's been working really, really closely with the homeless sector. So actually, I was at a round table with homeless sector organisations and domestic violence refugees the night that I got called about the first death in Birmingham back in March. And we've been working really closely with them throughout this. We've also been trying to work with private hostels, what's called exempt accommodation settings as well. And Councillor Thompson's been leading a lot of that work to make sure that they're abiding by the guidelines, but also to help them and give them advice. And we are working with Public Health England, where there are clusters of cases in what are called communal dwellings. So whether that's a care home or that's a student hall of residence, or that's an asylum seeker dispersal centre, Public Health England is contacted, they have a conversation with us, and we work closely with colleagues in the NHS to make sure we can give them the best advice on how to manage that and how to support people in those situations. You know, ultimately, what this outbreak has shown all of us across the country, but particularly in Birmingham, is that the inequalities you mentioned before are real, and that they are costing people their lives. And they've been there for decades. And I know across the council, we are all committed to looking at how do we change that moving forward. Recovery is not about returning to the world we had before. It's about building a better world and a better future for Birmingham together. Great.
Thank you so much, Dr. Justin Varney, Birmingham City Council's Public Health Director, for joining us. And can I also thank Councillor Paulette Hamilton, who's the Cabinet Member for Adult and Social Care at Birmingham. Both of you, your leadership in these past few months has been phenomenal. And both of you, in terms of an officer at the council and as a politician and an elected member working together, your work has been outstanding, and it's been appreciated by many within the council, our stakeholders across the city, and also those that were the residents within our city too. And it's been picked up nationally. Birmingham has been at times flying the flag for not just our city, but for many other cities and towns across the country. So I want to say thank you for your leadership, and thank you for joining us here today. Have a good evening. Thank you.
Thank you very much.
Thank you. We've got one final guest at this very unique Lozells Ward Forum, which is obviously COVID-19 focused. We've got a lot of a substantial amount of small businesses, whether we talk about Lozells Road, Villa Road, Heathfield Road, Nursery Road, and some within the residential streets in Lozells too. And many of those businesses, if not all of them, have had challenges because of COVID-19. So I thought it's really important that we had somebody from Birmingham City Council's Inclusive Growth Department to come and talk to us about what support is available to us. And I've invited Mohammed Zahir, who leads on some of the work around business support. Mohammed, can you hear me okay?
Yeah, I can hear you.
I think we're not going to see you. You're not going to put your camera on, are you?
I'm underveiled at the moment.
I'm not going to comment on that. Mohammed, do you want to give us some information about what support is available to businesses here in Lozells and across the city of Birmingham?
Yes, of course. What we initially did, we actually engaged with small businesses within the city. We did a survey just to get a better understanding what the impact was and what sort of interventions they were looking to from the city council. We had a great response. We had about 1,000 businesses respond to us. And what they were basically saying to us is the government intervention through the furlough scheme, through the small business grants and the loan interruption scheme was all very welcome, but there were still gaps in provision. And a lot of the businesses that we deal with were actually missing out. In terms of the small business grant scheme, this was grants between £10,000 to £25,000 available for the retail, hospitality and the leisure sector. Depending on your rateable value, I think if it's below £15,000, you get up to £10,000. If the rateable value is below £51,000, then you get up to £25,000. That's the government essentially gave the city council £230 million to administer as for the small business grants. To date, just to give you a flavour how well we've actually gone on with this, we've allocated and distributed and paid out about £120 million to 9,500 businesses within the city. So that's over a 4-week period. I think, from a ground zero start, that's been a tremendous effort on behalf of my colleagues within the City Council to actually get this money out. One of the major challenges we've had in terms of the small business grants is not having the bank details and not all the companies actually contacting the City Council to actually apply for these particular grants. So whilst we've got £120 million already allocated, we've still got another £110 million available to support our communities and particular communities within your area. So my plea today is to all those businesses within the Lozells area, if you haven't applied, please apply. Go online. It's a very simple system. Put your details in terms of your business, your small business rates relief reference number, and your big bank details. And we in the City Council will try and help you process that and get that money out to you. This money needs to go out to businesses within our communities. What we don't want to do is actually get the money sent back to government. And I think that'll be a major loss for us and our communities if we have to give that money back to government. The other thing, in terms of some of the other stuff, in terms of the loan, there is a loan interruption scheme that the government has made available, which is available at small businesses, medium-sized businesses, as well as large businesses. For the majority of our businesses, in terms of the small businesses, basically loans are available to £5 million. And for the first 12 months, it's interest-free. These are available, accessible through your high street banks. In fact, there are 40 lenders nationally actually administering these loans. As with a lot of these loan schemes, there is a slow start. There were teething problems, but the government, to their credit, have made adjustments. And I think just over 50% of the application have been approved to date. And the government have continued to listen to businesses in terms of making adjustments, particularly in terms of security and personal guarantees and so forth. All those obstacles and barriers have been removed. But the major issue in terms of, particularly for the smaller businesses, is the issue of affordability, is the issue of relevance to them in terms of loan finance. They may be already indebted in terms of loan finance, and the last thing they want to do is take on further loans, and then obviously that puts more pressure on the business in terms of repayment. And that's been one of the major obstacles why some of the smaller businesses within our communities have not taken advantage of these loan schemes. Now, one of the other things we've done proactively is recognizing that the small business grants are not necessarily appropriate for all the sectors, because obviously not everybody's in the retail, hospitality and leisure sector. There are other sectors, manufacturing for argument's sake. All of those sectors don't actually qualify for the small business grants. So what we did, in following on from the survey that we did, we actually developed a proposal to say, look, government, thank you very much for all the provisions you've made, but there are gaps here. We need additional support for all those businesses that actually are not able to benefit from the small business grants, and also for whom the loan option isn't appropriate, it isn't affordable, and it isn't relevant in a lot of cases. So what we did, we put a very substantial proposal together, £100 million proposal called the Business Survival Fund. That we went to other cities, core cities across the UK. I'm very pleased to say that they were all very supportive of the proposal. And with their support, we actually wrote to government and ultimately went to the Chancellor to say, look, your package of support, what you put forward to us, is very good in terms of, it's welcome, but there are gaps in provision and we need to do more. That went in 2 weeks ago with the support of the core cities. And we're waiting for a response. And that, if we get approval for that, will be a major benefit. Just one more thing before I keep quiet. The government have recently, in fact, last Friday, announced a discretionary grant scheme. They've allocated a further 5% to each of the local authorities, a top-up basically. For Birmingham, it's just roughly just under £11.5 million for those people who have not benefited. We're still waiting for further guidance from government in terms of how we administer that. So there's a new lifeline there for those people who haven't benefited. I'll keep quiet now.
Great. Mohammed, thank you for that very detailed update on the variety of support mechanisms available for businesses here in Lozells and across the city, and there is a lot still available. And I want to encourage all businesses, please do contact the council, go on the council website. There's some very easy online forms to complete to get the important support that you all absolutely need in these challenging and difficult times for you. The private sector, The businesses are the backbone of our ward, of our neighbourhood, and of our city, and it's really important we support them because they employ local people. There's a lot of self-employed people. There's a lot of families that are fed through the local economy. Mohammed, there's a particular thank you I'm carrying from some of the member institutions of Citizens UK Birmingham for the
Okay.
engagement you did with them. They found it very helpful, and we had some really good positive feedback. I know you've been engaging with some of the businesses directly too. So can I thank you and your team for that? In closing, can you give a very short 30-second message of the support that's available still, and the website address that people can that can access further information?
Yeah, we've still got another further £110 million available through the Small Business Grant Scheme. If you go to Birmingham City Council website, www.birmingham.gov.uk, you'll find a link to COVID-19. All the measures in terms of the small business grants are there. You can click whether it's £10,000 or £25,000, and you can go onto the online form. You can complete that. If any business has actually made an application, but they haven't had a response, you can email me directly and I'll follow it up and ensure you get the money. My email address, mohammed.zahir@birmingham.gov.uk. That's my job, so it's no trouble to me. I'm here to help our businesses, our communities. So if there's anything I can do to help you, I've through you, I've had a lot of telephone calls and a lot of resolution. So I think, it's a question of making sure that you take advantage of what's available to you. If you don't take advantage, if you don't ask the questions, you're not going to get the support.
Mohammed, thank you so much for coming on the show today, or the forum rather. It feels like a television show, but it's actually the Lozells Ward Forum, and providing this very important information and the support you're currently giving businesses and the support you've given over many years as a very important officer at Birmingham City Council. So thank you, and have a good evening with your family.
Thank you. Take care.
Colleagues, that's it now. It's been quite a useful sort of experiment from my perspective. I've certainly found it very useful. We've had quite a few comments coming in. I'm sorry I couldn't get all the comments onto the screen. We've had quite a lot of positive feedback too. I'm really keen to continue this if people and residents of Lozells feel it's useful. So I want to get some feedback from yourselves. If you found it useful, contact me, email me. My email's been scrolling at the bottom of the screen there. waseem.zaffar@birmingham.gov.uk. I'm also on social media and any of the platforms that this has been shared on. It was a trial, and I know Birmingham City Council have been monitoring the meeting today to see whether they can do this in other localities too, in other wards and neighbourhoods across the city. It was a trial. It's something I thought would be helpful to update people in these challenging circumstances. I've been trying to protect myself and my family like everybody else during these periods of time, and I've not been able to get out there into Lozells like I normally would do. But I want to ensure that I'm still in contact with you. A lot of people are still in contact with me via email, Twitter, Facebook, other social media, and also through WhatsApp. So if you do have any questions, any comments, anything that needs doing, as far as I'm concerned, I'm trying to operate in the same way that I've been operating previously as a council for Lozells. But I will try to do whatever I can to support you. I just want to finally say a big thank you to everybody. A thank you to all the frontline services, the NHS, everybody in the NHS, the management, the staff, the volunteers, the doctors, the nurses, everybody's been phenomenal and incredibly brave during these times. The police, the fire service, the bus drivers, the tram drivers, the train drivers, all those key workers working in the council officers, you've been quite incredible. And I also want to say a huge thank you to the residents, the volunteers, the faith institutions, the schools here in Lozells and across the city. These are challenging times. This needs leadership, and I'm really proud of the leadership you've all shown in this city, and you've shown the best of Lozells, the best of Birmingham, and provided that leadership. And you've all been out there supporting your vulnerable neighbours, helping your vulnerable neighbours. And as was said earlier, you've been providing food to food banks and supporting a number of other mechanisms across the city. So thank you so much for everything you're doing. We're going to call it a day tonight. Enjoy the rest of the evening, your family. Enjoy the bank holiday weekend. Stay safe. The weather's going to be good. The guidance from the government are absolutely clear. Don't go out unless you absolutely have to go out for essential shopping, essential medical supplies, for your once a day exercise, and to travel to work if you can't work from home. Good night, and God bless.